All right, so welcome everybody to another EBFA webinar. My name is Dr. Emily Splichal, and I am a podiatrist in New York City. I am a human movement specialist, founder of the evidence-based fitness. So welcome to you all for tuning in. A free barefoot workout, which is my V-Core workout DVD. So if you're an advocate of the barefoot running or a barefoot running enthusiast, try and challenge yourself and see if you can identify this runner. So we're going to get started on what is a very important topic. It's a topic that I'm very passionate about, and it's all around barefoot running and how can we prevent injuries around this barefoot running or midfoot strike minimalist running technique. All of the webinars are recorded, so you can, if you missed something or you want to come back and listen again, they all are recorded and found on our YouTube website, our YouTube page, which is youtube.com/EBFA Fitness. And don't forget to follow us on Facebook, LinkedIn, and Twitter. So here we go, getting started. All right, so there are many misconceptions that still revolve around barefoot training or this minimalist training technique. There's a lot of controversy, especially in the podiatry community, on injury rates, efficiency, the biomechanics, which one really is better? Should we be shying our clients and our patients away from these minimalist shoes? Or is it really that the shoe industries are misguiding us in the benefit of these shoes, and that we actually should be doing more the minimalist or barefoot running techniques? So if we look at both sides of the coin, you have the strong barefoot advocates or the minimalist advocates. And what they're saying is that there's a lot of less ground reaction forces if you are striking in a midfoot or forefoot strike. We get this increased proprioceptive feedback from the bottom of the foot if we take away all those shoes, which means that we have better improved foot strength and mobility, and therefore have a lower injury risk doing the barefoot running. On the other side, you have the strong pro-shod or heel strike traditional cushioning shock absorption shoes, and what they say is that we need that cushion for the shock absorption, that our foot is not designed to absorb that shock, especially if you're running on concrete or a lot of the surfaces that are no longer or were not found back when a lot of people were running on the grass and more of the dirt gravel. A lot of the advocates for the pro shot are also saying that we need that motion control, that our foot is designed, we need to have that orthotic or that motion controlled sneaker controlling the rear foot and preventing excess motion within the foot. And it's that excess motion that you see in the barefoot running that's why they're getting the injuries. Another argument that they make is that we need to protect the foot from the glass, foreign objects, etc. when we're running. So one thing that I do want to clarify is when we say barefoot, we actually mean strike patterns. For the sake of this webinar, we're going to focus on strike patterns. So I know that you can do all the different strike patterns, whether you're in your Vibroms or your shoes, you're completely barefoot. So what we're going to focus on is the injury rates and the injury patterns for the different strike patterns. So the 3 different strike patterns that we have is a heel strike, a midfoot strike, and a forefoot strike. So when I see a patient and I ask them of their strike pattern, right, it would be more beneficial for me to, instead of saying, do you run in shoes or do you run barefoot? You want to make a solid argument around the biomechanics of running and minimalist running or strike patterns by speaking the right language. So we have the heel strikers. Heel strikers are going to strike their calcaneus or their heel bone, and then they're going to transition into the middle of the foot and then off of the foot into propulsion. What's interesting is in the midfoot and the forefoot strike is they totally bypass the rear foot, and land either on the midfoot or the forefoot. And we're going to see a little bit later in the webinar that they're missing a certain biomechanical phase that we have in the walking gait or heel strike gait that we do not see in the midfoot or the forefoot strike, which is why there are actually different biomechanical advantages to do more the minimalist or the barefoot running technique. But which of these is the most common? It's interesting that we still have the highest rate of runners are doing your traditional cushion shock absorbing shoes with a heel strike pattern. The next most common would be the midfoot strike, and very few people actually do a true forefoot strike. So if we're looking at this, is a heel strike really that bad? If we look at this picture, yeah, he's running on concrete with no shoes and striking his heel. That probably is not good. But if we took and compared somebody who's running in a minimalist shoe, striking their midfoot, to a heel striker in a shoe, is there a big difference? Is this heel striker encountering greater ground reaction forces? Is he getting more injuries because he's striking his heel first? And then is he heel striking, or is his heel strike making him less efficient at running? So this all has to do with biomechanics and the way that the body responds to these different biomechanics. So we have our heel strike pattern. We have the picture that we just looked at. This runner, when he runs, he's going to encounter between 3 and 4 times his body weight in ground reaction forces. And if we look at the image on the bottom, this is a pressure curve, and it's responding to the ground reaction forces over time. So this peak, the impact peak, which is a sharp initial peak in those ground reaction forces, is when that heel is striking the ground. We then see a sudden decrease in the ground reaction forces, and then we have another peak that actually goes higher than that initial peak. So this is a lot of confusion that I get when I travel and do lectures, is that people make the argument that striking the heel, that's where you're getting most of your ground reaction forces. That there's a sudden jolt to the body, your heel strikes the ground, and those ground reaction forces peak extremely high. That's true, but that peak of ground reaction forces really is not as high as when you transition into the forefoot. And if we look at injuries in the foot, whether you're a midfoot striker or a heel striker, most injuries in the foot occur in the forefoot. And the reason is because that highest peak of ground reaction forces is actually in your forefoot when you are in the push-off phase and you're pushing off into that next step. So again, it's interesting that the peak ground reaction forces is not at the heel strike, even though you're heel striking. But what we do see is if we switch into a midfoot strike, we actually lose that initial peak of where the heel striker contacts their heel. But if we look at the midfoot strike and where they get their peak ground reaction forces, it is in the exact same place as the heel striker. And in this image below, in this certain study, they actually saw higher ground reaction forces in the midfoot or the barefoot runner. But why is that barefoot runner not getting more injuries than the heel striker? Or how is that argument still valid that midfoot running has less injuries than heel running? And that argument is that this peak of ground reaction forces is actually spread over a greater amount of time. So it's less sudden impact. The higher ground reaction forces is spread out, so the body is able to absorb and dissipate all those ground reaction forces and therefore decrease your risk of injury. If your body cannot absorb those ground reaction forces, then we will lead to, which is our first injury and the most common injury that I see in my office in minimalist or barefoot runners, is the stress fracture. So again, this is one of the most common injuries. If you work with any runners or clients or patients who are avid runners or barefoot runners, this is the most important injury that you will want to prevent. A stress fracture, as indicated here on the x-ray. So we can see there's kind of a bulge on the inside or the medial aspect of that metatarsal. Most common in the second metatarsal, because if we look at that pressure curve again, right where we're having this highest peak of ground reaction forces, that is your second metatarsal. So, second metatarsal of all the bones in the foot has the highest ground reaction forces, or the highest force with every step that you take. So that means we have to protect the body and train the body to absorb these ground reaction forces so that our client or ourself does not experience a stress fracture. Now, stress fracture, unlike a impact or a traumatic fracture, is a little bit more like a hairline fracture. Starts as just a small break in the bone. If you continue to run on a stress fracture, it will then go all the way through the bone and you will have a nice delineation or a fracture line. Treatment for a stress fracture, just like every other fracture, is you have to immobilize, get off of the foot. I usually put all of my patients on a bone stimulator so they can heal very quickly and be back to running. So again, we're talking about prevention. We want to prevent those runners and those clients from getting these stress fractures. What's interesting is that heel or rear foot runners or shod runners actually dissipate ground reaction forces different than your barefoot runner or your midfoot striker, your minimalist runner. So depending on which type of runner your client or you are, or your patients are, you need to train them, their body, their foot, to dissipate ground reaction forces differently. So shod runners, heel strikers, absorb ground reaction forces through pronation. Pronation is controlled by our posterior tibialis and our soleus muscle eccentrically. So that means we need to be training those two muscles eccentrically to control pronation and to better absorb ground reaction forces. Shod runners also do knee flexion and hip flexion, which means we need to train those quads and our glutes eccentrically. If we look on the flip side, the barefoot runners or the midfoot strikers, they actually dissipate ground reaction forces through their intrinsic muscles contracting. They dissipate ground reaction forces through the eccentric contraction of their calves, which is different, a different type of eccentric contraction than the shod runners. And then they also have a little bit of knee and hip flexion. So again, to get the best results and to truly prevent stress fractures in your runners, you have to look at what type of running technique they are. Are they shod runners? Are they barefoot runners? You got to train them specifically for how they are running and how their body will dissipate those ground reaction forces. Since our focus is the barefoot running, we are going to look at intrinsic foot strength. The best way to train your intrinsic foot strength is barefoot training. So if you're a big advocate of barefoot running, this is right up your alley because we're applying that same science into your preventative techniques. So what we need to do is train the skin on the bottom of the foot to take that feedback from the skin and get it into those intrinsic muscles as quick as it can. What's interesting is that ground reaction forces are actually vibrations. The body does not like vibrations, so as those vibrations start going through the foot, the muscles contract to dissipate and quiet those vibrations. We have very specific skin vibratory proprioceptors that will respond to those ground reaction forces and get that feedback right into those intrinsic muscles so then they can contract. The intrinsic contraction is actually your body's first and actually innate mechanism for dissipating those ground reaction forces. Second technique that I like is what's called short foot. If you've ever taken any of my workshops, I'm a huge advocate of short foot. Talk about it a lot. What the short foot does is it targets your abductor hallucis. So now what we're doing is specifically training one of your intrinsic muscles that can help initiating the dissipation of those ground reaction forces. So when you do short foot, I recommend maybe Googling how to do short foot. And what you want to do is you pull the metatarsal heads back to the heel, and you're going to feel the muscle underneath your big toe and underneath the first metatarsal is going to contract. Your abductor hallucis actually controls your arch height, so you will see an increase in your arch just like as in the picture. So want to hold it 8 to 10 seconds, repeat 5 times. I usually have the patients do this as they're brushing their teeth, doing dishes, etc. So they're using it as something like a multitasking. They're doing something and doing their short foot at the same time. You can do short foot while waiting for the subway. You can find your best way. Second way that barefoot runners control the dissipation of ground reaction forces is through eccentric control of their calves. So what's interesting is that this eccentric control of the calves to start dissipating those ground reaction forces relies on both muscle and fascia flexibility. So just stretching is not enough to train those calves. We need to get that myofascia nice and free, very viscous, and that will allow better eccentric control and dissipation of those ground reaction forces. So the eccentric control of this posterior group is very unique to barefoot runners. So as you're striking your midfoot, your heel is going to drop down. That means your posterior group has to contract eccentrically to prevent that heel from slamming into the ground. Versus in a heel striker, the muscle that we're actually using eccentrically when we strike the ground is your tibialis anterior. So again, this would be the two different biomechanical training techniques. If you're a heel striker, right, you got to strengthen your anterior tibialis eccentrically. If you're a barefoot runner, you need to focus on strengthening your posterior group eccentrically. The training technique really has to fit the type of running that you, your client, or your patients are doing. So this leads to our second most common injury that we will see. This is Achilles tendonitis or a calf strain. So again, going back to those running techniques, when we normally walk, we're a heel striker walking, right? We strike the heel on the ground, tibialis anterior fires, we go into the middle of the foot, we begin to pronate to absorb those ground reaction forces, go onto the front of the foot and push off. So all of this is controlled through this pronatory influence. So again, pronation that is controlling the foot during heel strike running and walking. We flip that over to our barefoot running or midfoot running technique, and it is our calves that are used eccentrically. In a whole new way if you want to avoid Achilles tendonitis or calf strain in your clients, runners, or patients. So we want to prevent this. That means we need to free up the fascia. We're going to do fascial mobility. I highly recommend that all of my clients and patients do trigger point release, whether you're using a foam roller, TP therapy makes a great grid, or they have their footballer. I have all of them. That's the foundation of their foot prevention technique. Have to do some sort of myofascial trigger point release. We're then moving into eccentric training. You want to be very specific on what you're doing to eccentrically train the calves. I have all of my patients who are focusing on the up phase. They're going to focus on the negative or the down phase of that calf raise, just like in this image number 2. Once they have that eccentric control, and I also have them walk backwards on the treadmill. That's another awesome technique to train the eccentric control of your posterior group, is to walk backwards. Finally, once you get that eccentric control, we need to train the eccentric to concentric strength. So again, eccentric to concentric. There's also a form of fascial fitness. If you've ever read any of Thomas Meyer's work on fascial fitness, this is huge. It's talking about how the body responds to fascial pulls and kind of a kinetic release of energy. Very much falls in line with the same eccentric to concentric transfer. A technique that I have people do for that is jumping rope. If somebody cannot jump rope without getting an Achilles tendon or a calf pain, there's no way that they can run barefoot or in a midfoot strike. It's mimicking that same type of muscle strength and flexibility that they need to do midfoot or barefoot running. So again, that would be the preventative technique that you would use. Okay, third injury that we see, and this is again one of the most common injuries that I will see, is top of foot pain. So what this is, if you are a barefoot runner and you've gone onto a lot of the forums, you will see this TOFP a lot. What it is it's a vague, non-specific pain on the top of the foot, and it's felt on ambulation. So it's usually experienced by new barefoot runners, right? So it's a little bit of this too much too soon. Okay, if we look at the anatomy of the foot and we're looking at this picture, one, you can see the bones, but a lot of ligaments. And all of these small little ligaments, if you move your foot just slightly, a little bit off, you're going to tweak that ligament. Just like any ankle sprain, I see a lot of these midfoot ligament sprains that it's very hard to diagnose, but you really do need to just back off, pull away, control that inflammation, and then make sure that biomechanically you're running the right way. Another thing that you do want to consider is that this really can be confused for a stress fracture. So if you are having persistent pain, don't try to push through it and kind of muscle it up, because this really could be the early signs of a stress fracture. You can get stress fractures not just in your metatarsals, but you can get stress fractures in your cuboid, your navicular, and your cuneiforms. So you do want to be cautious with that. Okay, so how can we prevent top of foot pain? So what we need to do is make sure that our biomechanics are nice and sound. Remember that it is the intrinsic strength of the muscles on the bottom of our foot. We have 18 muscles in the bottom of our foot. All of those muscles play a very important role in controlling our foot biomechanics, improving our foot stability, and most importantly, absorbing those ground reaction forces. So we need to have solid intrinsic foot strength. We need to do proprioceptive training. Our ligaments actually have a lot of proprioceptors within them. And those ligaments help tell your foot that positioning, and it's able to respond to shifts in that position. So you want to do proprioceptive training as a foundation to your barefoot running program, or as a way to prevent top of foot pain. And then you really do want to progressively increase your mileage. So it is a little bit of the too much too soon, but I advise patients and runners to take it a little bit further and build some foundation to their foot function and their barefoot or their proprioceptive response. So few final misconceptions and how this can translate into injury risk is heel striking actually less efficient? So when we look at the biomechanics of a heel striker, right, they're initially striking their heel or their rear foot, and they're transitioning into the midfoot and then pushing off of their forefoot. Remember, I had said earlier that what's controlling the transition from the heel to the middle of the foot is pronation, right? So it's that pronation that is controlling the heel to the middle of the foot. If we look at a midfoot strike, we actually land on our midfoot. So we totally bypass the rear foot, which means you are not getting any of that pronation. Guess what? That pronation phase takes time. The more time that you are on the ground, the greater risk you have for injury and the less efficient you will be. So the objective as far as efficiency is, if you can bypass pronation and strike the ground in a supinated position, you're all ready to push off, and you're going to be much faster and much more efficient. You also will have decreased risk of injuries, which are very specific to the posterior tibialis, the soleus, and the plantar fascia. So that would be your biomechanical argument of efficiency between heel strike and midfoot strike. So again, another kind of question, is the best way to prevent barefoot running injuries simply doing too much too soon, or avoiding doing too much too soon? Take barefoot science and the function of the foot a step further and do programming to prepare their body. Barefoot running, just like any other sport or activity, you need to train the body and prepare the body or in this case, the foot, to respond to that technique. So we're going to do barefoot training, wake up the proprioceptors. We're going to strengthen our intrinsics. I recommend doing short foot to get that abductor hallucis firing. We're going to start doing some eccentric training, whether it's reverse heel lifts, walking backwards on a treadmill, and then start integrating your body responding to these eccentric contractions by jumping rope. That should be the foundation of every barefoot runner's first steps before they start getting on out and actually running. So another thing I hear a lot is all I have to do is run barefoot and I will strengthen my feet. So their foot strengthening technique is actually running barefoot. I never use running barefoot as a training technique. The reason is that you have to prepare the body to do barefoot running. It is a form of training, and a lot of athletes do their agility training barefoot, but you still have to prepare the body to actually do that barefoot running or the agility training. There has to be a few first steps if you want to reduce the risk of injury. So we want to prevent barefoot running injuries. Some pearls that you guys can take home is no type of running is injury-free, right? Whether you're a shod runner, you're a heel striker, midfoot striker, you're barefoot, you're in the newest Nike Shocks, right? No type of running is injury-free. Yeah, we are designed for running. Maybe some people argue that we're not, but and your body has to respond to those ground reaction forces. So no type of running is injury-free. Almost all running injuries are related to overuse or poor dissipation of ground reaction forces. Almost every injury I see in my office is related to poor dissipation of ground reaction forces. That means match the type or the training type to the way that you're running. If you're a shod runner and a heel striker, you have to train your posterior tibialis eccentrically. You have to train your soleus eccentrically. If you are a barefoot runner, that means we have to train those proprioceptors, our intrinsic muscles, and those calves eccentrically. So match the training technique to the running pattern. Barefoot and shod runners dissipate ground reaction forces differently, right? So train your body for your running technique. Train the proprioceptors and intrinsic muscles for barefoot running. I recommend short foot. Again, if you want to learn exactly how to do it, I have some articles on the blog on the EBFA site, or you can Google how to do short foot. Fascial fitness and eccentric strength is important to preventing calf and Achilles tendon injury. Most important one here is probably that fascial flexibility. So check out tptherapy.com. They got some great products. Get on the foam roller and start to loosen up that fascia. And then most importantly, we really want to apply barefoot science to the prevention of barefoot running injuries. There's so much great research about the benefits of barefoot running and getting out of those shoes and those orthotics and waking up the foot. But let's use those same barefoot science principles and prepare the foot for those barefoot running techniques so then we can avoid these injuries. So that brings us to our fun quiz or test is, who is this? If you think that you know who this is, then type it into your question and let me know if you do not know. I will give you a few minutes. If you have any questions that relates to, some people got it right, I'm very happy. If you have any questions that relate to barefoot running or any barefoot running injuries that you may have or that your clients, your patients have had, you can type those in as well and we'll go over those. Okay, so we have 3 winners. No more time. You all have won a VCOR DVD, so please make sure that you email me. Who we have here is Abebe Bikila, which is an Ethiopian runner. He's most famous for winning the Olympic gold medal for the marathon in the 1960 Rome Olympics, and he won it barefoot. So he's most famous for that. If you're an enthusiast for barefoot running, I recommend checking out him. So for more great tips on building barefoot strength or foot strength and reducing injuries, please check out our website, ebfafitness.com. If you want to also enter some questions that you may have, or you are an advocate for barefoot running, or you're a barefoot runner yourself, I recommend checking out Barefoot Runner Society. It's a great website. It's a forum. You can network and connect with other barefoot runners, and they have a great Ask the Doctor forum, so you can ask any of your questions there. All of our webinars are archived and kept on the YouTube page, youtube.com/EBFA Fitness. So I think everybody is now going to hit me up for a DVD. VCore DVDs for everyone. So if you knew that it was Abebe, please email me, education@ebfafitness.com, and please include your address. And you guys have a VCore workout DVD, which is a barefoot balance workout that I use and I've done some case studies on to reduce the risk of injuries in barefoot runners and to improve foot strength. So, question is, you covered heel strike and midfoot strike ground reaction forces, but did not cover forefoot ground reaction forces. How bad is it? So it really is similar. Most of the research is on midfoot strike because, again, as I had mentioned earlier, very few people do a true forefoot strike. And if you want to differentiate what's between a midfoot and a forefoot is when you do a midfoot strike, you're in about 5 degrees of plantar flexion. If you start increasing, you're getting around this 15 degrees plantar flexion, that would be a forefoot strike. And again, it's hard to capture unless you have a high-speed camera or you're able to freeze frame it and actually catch the degree of plantar flexion. But again, as far as is somebody doing a midfoot strike or are they doing a true forefoot strike, look at the degree of plantar flexion, not where they're striking their foot, but again, where is that ankle? Is the ankle in, you know, a few degrees plantar flexion? That would be your midfoot strike. Around that 15 degree, that would be your forefoot strike. It would be very similar. One difference that is noted between a midfoot strike and a forefoot strike is that a forefoot strike actually has greater leg, so knee and hip stiffness when they strike the ground. So you may see some different injuries in a forefoot strike than a midfoot strike as it relates to knee and hip impact. You may also see if they're landing on the forefoot is an increased risk of rolling the ankle because the timing on that forefoot, just due to surface area, you have to be really precise. So that's what I would look for that one. Everyone who mentioned Abebe, again, please email me. If there's any questions, let's see. Okay, so another great question. Can you please elaborate on the basis of barefoot training versus shod training and which is more preferred among athletes? I'm a huge advocate of barefoot training, and the reason is that our foot really is the foundation to every move that we make. This is both from a biomechanical standpoint and from a neuromuscular standpoint. So if you work with athletes, I recommend doing the barefoot training as part of their warm-up. So they're doing part of this dynamic stretching neuromuscular warm-up. You want to be doing the barefoot training at that same time. So you're waking up the proprioceptors on the bottom of the foot. You're training the glutes to fire at the same time as the bottom of the foot, and that would be beneficial to an athlete where you want to reduce the risk of injury and increase their agility and reaction time. So again, I would favor more on the barefoot training. You obviously can't do all of your training barefoot, especially in certain sports, but definitely fit that barefoot training into their warm-up and whenever they're doing all of their neuromuscular conditioning. So, any other questions? I am much faster barefoot than with shoes. Is it because the propulsion or more likely because of the weight of the shoes? If you feel like you're running faster, you're more efficient, biomechanically, that's because you're totally bypassing the pronatory phase. So pronation takes time. If there's 3 phases that we typically have to go through, which is heel strike, into the midfoot, and then into the forefoot or propulsion, if you take away one of those phases, excuse me, you're definitely going to be faster. Propulsion takes time. Eccentric and deceleration contractions take time. So that would totally match and is expected that you would be faster if you run barefoot or midfoot. See if there's another question. Sorry, now I'm losing my voice. Is there any limitation on how often we can run barefoot on a weekly basis? That really has to do with your fitness level and how long each run is. If you're an athlete and you're integrating it into the warm-up and you're doing a lot of the barefoot work, again, excuse me, my goodness, from a proprioceptive standpoint, then it's fine to do every day. You need to just make sure that your barefoot training is matching your recovery. Excuse me. So where I see a lot of injuries is that the impact they're putting on the body is exceeding the amount of recovery that they're doing. So there's no harm in doing barefoot running every day. You can do any activity every day as long as your recovery matches the amount of stress that you're putting on the body. And this really goes for anything. If you want to learn more about this and kind of recovery, meeting the demands of the body and stress, I recommend looking up what's called the tissue stress theory. And this is the foundation on how I treat all of my patients. And that is just saying that all of our body, or all of the soft tissue in the body, is able to withstand certain stresses. And when you exceed a certain threshold, then it kind of goes into this domino effect of like an inflammatory cascade, tissue starts breaking down, etc. So as long as your recovery matches the amount of stress you're putting on that soft tissue, whether it's barefoot running or any other technique, then you will be fine continuing doing that barefoot running every day. Does taking quicker steps reduce the impact forces? So a lot of the injuries, that's a very good question as it relates to heel strikes or rear foot striker and their injury rates. A lot of the injuries seen in shod runners and heel strikers is that a lot of them are actually overstriding. So I would focus less on taking quicker steps and just make sure that your stride length is actually accurate. A lot of barefoot runners still overstride, and if you watch how you're running, you have it recorded, somebody's watching you, you're watching your clients, is make sure that they're not overstriding in their midfoot strike and actually landing on their heel. I often see that in novice or inexperienced barefoot runners, as they will try to do that continued overstride, which is classic of a heel striker or a shod runner. So a lot of the research has also said that you cannot do true midfoot striking unless you're around 8 miles an hour pace, like an 8-minute mile pace. You know, some people argue that, but you know, if you feel like one of your clients or patients is having a hard time getting the midfoot strike pattern, it could be that they're not running fast enough and that you want to either try and pick up the pace, or if they're not in shape to run at that pace, then it may not be beneficial for them to try and switch into that midfoot strike pattern. So those are also some additional things to consider, is just make sure that they're matching their technique, or they're not overstriding. All right, so we have many more questions. What I'm going to do is answer these questions, because I know that there's a lot of people who are still tuned in, and I'm going to answer these questions and then put them in a blog, because I think that there's a lot of excellent questions that everybody could benefit from. And if people have to, you know, go because I've taken 40 minutes of their time, which I appreciate, then I don't want them to miss the question. So all of the questions will be answered. If you have to leave for any reason, please know that these will be typed up and answered into a blog. So if you want any of these studies, I recommend that you check out www.stephenrobbinsmd.com. He's one of the leaders in barefoot science research and the negative impact of shoes. Again, Stephen Robbins, a lot of his research is from the 1980s. So he is one of the first people to start doing this barefoot running, barefoot training research. Another great researcher is called Nigg, N-I-G-G. He's a biomechanist from Canada, and he has a book that's out, and he's published many, probably 100 biomechanical barefoot-based journals. A lot of those are on the EBFA portal. So if you are a barefoot training specialist or you have access to the EBFA online portal, those are found on there. If you do want to get some of those, you can either email us or you can sign up and get access to those through the EBFA portal, which is also found on our website. Okay, all of these questions will be answered. If you did get the Abebe question correct, then please email me, education@ebfafitness.com, and you have a V-Core workout DVD, Barefoot Training Specialist, coming your way. Please stay tuned for all our other webinars. In February, we actually have another webinar with Kevin Moore from Hong Kong. He's going to be doing a great webinar on the psoas. So if you have any clients with psoas dysfunction or any patients with that, it's going to be a great webinar. We also have some great workshops that are coming up, and they are both in the US and in Asia, India, and we're going to Sweden as well. So I thank you guys so much. Please stay tuned for the archive version and for our blog that will have every single one of these questions answered. Thank you guys so much.